Alright, in this video we're going to continue on and talk about white blood cells. But we're going to be more looking at the production and lifespan of white blood cells. So let's talk first about leukopoiesis, which sounds similar to erythropoiesis. Whereas erythropoiesis was the production of red blood cells, leukopoiesis is the production of white blood cells. And this process is going to be stimulated by two types of chemicals, interleukins and colony-stimulating factors. Interleukins are generally numbered and abbreviated IL, like IL-3 and IL-5, and colony-stimulating factors are abbreviated CSF and named after the white blood cell type that they stimulate, like granulocyte CSF stimulate granulocytes. Now, regardless of the leukocyte, they all originate from the hemocytoblast, which is a stem cell found in the red bone marrow. That stem cell can turn into one of two stem cells called a lymphoid stem cell or a myeloid stem cell. Now, lymphoid stem cells proceed with a pathway that only produces lymphocytes, whereas myeloid stem cells produce all other blood cell elements, including all other white blood cells except lymphocytes, platelets, and red blood cells. Now, once you leave that myeloid or lymphoid stem cell stage, you're moving into what we consider committed cells, like a myeloblast. And so that arises from that myeloid stem cell line, eventually produces band cells, which is the stage right before we get a mature granulocyte. And we really start to see those segmented nuclei, and those are what are released into the blood when it comes to granulocytes. Now keep in mind, I said this fact before in a prior video, but 10 times more white blood cells are stored in bone marrow than in the blood. And 3 times more white blood cells are formed than red blood cells because white blood cells have a shorter life. Usually it's cut short by fighting microbes. Now, agranulocytes are produced in one of two ways. Because it's the lymphocyte that is derived from the lymphoid line, it is a separate production pathway compared to the monocyte and its committed cell called the monoblast. And again, that monoblast is coming from the myeloid line. That monoblast turns into a mature monocyte and can live for several months, and its pathway is rather short. Whereas the lymphocyte is derived from the lymphoid line, it creates T and B lymphocyte precursors, and while those all originate in the bone marrow, T lymphocytes actually leave while they're immature and go to the thymus and mature in the thymus. That's actually why T lymphocytes are called T lymphocytes, because of where they mature. So thymus starts with T, T lymphocyte starts with T. Now B lymphocytes, they give rise to immature B lymphocytes that are ready to turn into plasma cells as soon as they're activated, but they stay in the bone marrow. They are made and mature there. So bone marrow starts with B, B lymphocyte starts with B. Now, so there's kind of this double step to lymphocyte development, but these lymphocytes can live either from a few hours to decades, so you want kind of areas where you can store them. So here's that leukocyte formation image. This is figure 16.11 in your textbook. At the top, we're looking at the hemocytoblast, or the blood stem cell called the hematopoietic stem cell. Now, those two stem cells that come off of that are the lymphoid and myeloid. Lymphoid on the right, myeloid on the left. And you can see the myeloid gives rise to every white blood cell except lymphocytes. And the lymphoid stem cell gives rise to the B and T lymphocyte precursors, which can mature into immature B and T lymphocytes that may become activated. Now, what's not shown here is that the myeloid stem cell also gives rise to platelets and red blood cells. So let's try some practice questions. True or false? Overproduction of white blood cells is leukocytosis. If you said true, you're correct. What about a multiple choice question? Which of the following is considered a type of lymphocyte? Let's look at our options. We got macrophage, neutrophil, B cell, basophil. What do we think? If you said B cell, you'd be correct. Remember, a macrophage, a neutrophil, and a basophil, all of those are different types of white blood cells, whereas a B cell is the nickname for a B lymphocyte. All right, let's continue on and talk about some clinical homeostatic imbalances. A lot of hematopoietic hormones like erythropoietin, which we talked about, which upregulates or increases red blood cell production, can be used clinically. but also CSF, like colony-stimulating factors, which upregulate the production of white blood cells. That can also be used clinically. We could use them to stimulate the bone marrow of cancer patients that are receiving chemotherapy, or give them to those that are experiencing stem cell transplants. You can also clinically use them to increase protective immune responses for AIDS patients. And so different disorders may require different treatments, and we're going to be talking more now about white blood cell disorders. So let's move to the overproduction of abnormal white blood cells called leukemia. And there's also kind of another type, which is infectious mononucleosis. Now, leukemias are cancer. They are going to be cancerous conditions that involve the overproduction of abnormal white blood cells. But it is being here grouped with infectious mononucleosis because we see kind of abnormal development of lymphocytes with infectious mononucleosis. But both of these conditions generally create what's called an abnormally low white blood cell count, or leukopenia. And that can be drug-induced, it can be because of anti-cancer drugs or glucocorticoids, but that's generally a result of those conditions. Now, leukemias again are cancerous conditions involving the overproduction of abnormal white blood cells, and usually it involves just one single clone. Now, whether that clone is from an early developmental stage or later determines if the leukemia is acute or quickly advancing, or chronic, which means slowly advancing. So since it's named according to that abnormal white blood cell clone, myeloid leukemias involve the myeloblast descendants, and lymphocytic leukemias involve the lymphocytes. Unfortunately, acute or quickly advancing leukemias are derived from stem cells, and they primarily affect children. Whereas the chronic or slowly advancing leukemia involves proliferation of abnormal white blood cells from later stages in the developmental pathway, and they tend to be more prevalent in older people. Now, without treatment, all leukemias are fatal because you get immature, non-functional white blood cells flooding the bloodstream because the cancerous cells that are abnormal fill the red bone marrow and push out or crowd out all the other cells even before they're fully developed. That can lead to anemia and bleeding because of abnormal red blood cells that don't have functional hemoglobin, and because you have an entirely large amount of blood cells, it may be immature platelets that are not doing their process or function like they should. And death is usually therefore from internal hemorrhaging or even overwhelming infections because of these immature non-functional white blood cells not being able to fully function and help your immune system. Treatments include things like irradiation, anti-leukemic drugs, stem cell transplants, and depending on the person, it can be a series of these treatments that they need. All right, let's also look at infectious mononucleosis, which is also known as the kissing disease and is caused by Epstein-Barr virus, or the EBV. It's highly contagious, usually seen in young adults, and has symptoms that are kind of like the flu: tired, achy, chronic sore throat, low fever, and can last for 4 to 6 weeks with rest. Now, we originally thought that the cells affected in infectious mononucleosis were monocytes, so hence the disease, mononucleosis. But it's actually the lymphocytes that are involved and become enlarged and more non-functional. All right, one of the last formed elements we're going to look at is platelets. Now, platelets are just fragments of larger megakaryocytes. Megakaryocytes are big cells from the myeloid stem cell line that through their development start to produce cytoplasmic extensions and try to escape the bone marrow, but they can't, and their extensions get kind of cut off, and those pieces are what ends up in the blood. So again, platelets are just fragments from that larger cell. Platelets are blue staining, they have some purple granules, and they contain several chemicals that help with their function, which is blood clotting. Things like serotonin and calcium and enzymes, the breakdown product of ATP called ADP, and different growth factors. So their overall function is blood clotting. They themselves form a temporary platelet plug that helps seal breaks in the blood vessels. Now, normally a platelet plug isn't something that platelets are constantly making. Usually they're kept completely inactive and they're mobile, and that's because nitric oxide and prostacyclin are going to be released into blood, and that's going to keep them from sticking and producing their own chemicals that cause a platelet plug. Now, platelets are formed by the release of a hormone called thrombopoietin. Another name for platelets is thrombocytes, So that's where thrombopoietin comes from. Now again, we're going to use the myeloid stem cell line to create platelets, but from the myeloid stem cell, we get a megakaryoblast stage 1, and it's very large because it performs mitosis but doesn't separate the cytoplasm. So it just gets bigger and bigger as we move towards stage 4. The stage 4 megakaryocyte sends cytoplasmic projections or extensions into the lumen of sinusoidal capillaries, which are very porous. But the whole cell is too big to get out, so these projections break off into platelet fragments. And it's these fragments of the megakaryocyte that we call platelets, but since they're just small pieces of a cell, they age quite quickly, and they degenerate in about 10 days. So they last even less than red blood cells, which last for about 120 days. But a normal amount of platelets to have in your blood is about 150,000 to 400,000 platelets per milliliter of blood. So here is that pathway for the formation of platelets. So we have the original stem cell, the blood stem cell or hematopoietic stem cell, sometimes called a hemocytoblast, that produces the myeloid stem cell that gives rise to the stage 1 megakaryocyte called a megakaryoblast. Then we see stage 2 and 3 megakaryocyte getting bigger and bigger, and it's the stage 4 megakaryocyte that has those cytoplasmic projections that break off to create platelets in the blood. And so now we've talked about, if you've watched all the videos, all of the formed elements. Red blood cells with their biconcave shape and function to transport oxygen and carbon dioxide. Leukocytes, or white blood cells, which have various functions like being phagocytic, killing parasitic worms, modulating the immune response, helping with allergy and asthma, releasing histamine, and also turning into macrophages and cleaning up tissues. And then we looked at platelets, which are cell fragments that help with blood clotting, specifically with forming a platelet plug. So before we continue on, let's try some practice questions. True or false, platelets are derived from megakaryocytes? We just covered that, so hopefully you said true. Let's try a multiple choice question. The migration of white blood cells out of capillary blood vessels and into tissue is called, our options are transcytosis, active transport, diapedesis, leukocytosis, and pinocytosis. All right, what is it? Hopefully you said C, diapedesis. That was the process we talked about in a prior video where white blood cells can move through the endothelial cells or inside lining of blood vessels into tissue, and that squeezing process from blood to tissue is diapedesis. All right, make sure also now to watch the next video where we're going to cover this, hemostasis, which is a series of reactions to stop bleeding. So a little bit more on platelets.